I'm Dr. Dwayne Heilbronn, and I work at Valley OB-GYN Clinic in Saginaw, Michigan. I originally was born and raised here in Saginaw and actually lived here until after I finished high school. I then went on to college in Indiana, and then my medical school training and my residency were both in Detroit, Michigan. I did my initial training after finishing medical school at Wayne State University and Detroit Medical Center affiliated hospitals in Detroit, where I did a 4-year residency in obstetrics and gynecology. After that, I went into practice for 3 years in Ann Arbor, Michigan at St. Joseph Mercy Hospital there. I then decided to move back to my hometown, Saginaw, Michigan, and I've been here since 1992. I grew up in a household where my father was an obstetrician gynecologist, and even though he kind of discouraged me from considering the specialty, when I went through medical school, I found that it was a perfect combination of primary care, taking care of people primarily, but then also a good combination of surgery and then also delivering babies, which is one of the most pleasurable things that we do as obstetricians. I have interest in some high-risk pregnancy, difficult vaginal deliveries such as breech presentations, forceps, and vacuum deliveries. But in the gynecologic realm, I have a special interest in pelvic organ prolapse and treatment of urinary incontinence problems. Women's health is important mainly because such a large component of our population is women, for that matter. But there's also just a plethora of problems that arise that are unique to females. And during the course of my training, I gained an appreciation for the uniqueness of those problems that happen to female patients. I've been in practice for over 30 years, and in that time I've gained a lot of experience and a lot of exposure to difficult and unusual situations. I think that provides for me a special sort of touch in terms of being able to handle problems that might be unique and oftentimes not seen in people who've been practicing a shorter period of time. I like to take the training that I had during my residency and apply it to real life situations. And I like to think that I apply those principles to each patient individually and uniquely.